Good morning. Good morning. Welcome. It's Saturday morning for me, wherever you are. I'm sure it's Saturday at some point, or at least I think it's Saturday at some point for all of you. Morning, midday, afternoon, evening. Welcome to my free training on explaining the unexplained. We're just going to give everybody a little bit of time to join in, a couple of minutes before we get started. As you are here, and just so I know that you are here and that you can hear me, just say hello and let me know where you are joining from. My assistant tells me it's working, so that's good to know. Hi, Roshni. Welcome. It's nice to have you here. I appreciate it. Appreciate you joining. Where are you joining from? So I've woken up earlier than I normally would on a Saturday to be here with all of you. So I'm excited for that. I am ready. I've got my water and my morning coffee. And Zaharine, I'm sorry if I pronounced it wrong, says, hi, I'm joining from London, which is awesome. Let me see, can I do this? Awesome, look at that. I could pop it right up on the screen, London. And Julie says from Canada, how fun. Someone's joining from New Orleans and someone from Jordan. Wow. We have people from all over the world joining us. I'm so excited, so excited. Victoria is from SC. I imagine that is South Carolina. South Kakalaki. Welcome. My wife is from South Carolina. So thanks for joining. Curacao. We've got Curacao. Look, we are reaching everyone all over the globe because all of you have been told or are not satisfied with the diagnosis of unexplained infertility. And so if you've been given that diagnosis and you're not satisfied with it because you know there's an answer, like I know there's an answer, then you are in the right place today. Hina says, Dubai, awesome. And Victoria says, yes, that is South Carolina. So awesome. And we've got India and we've got Nigeria. Look at that. And then we've got East Africa. Look, we are truly, truly, truly hitting and reaching the entire globe with this important message because so many of you want answers to your fertility journey so that you can get the results that you want and that I want you to get, right? And so that's what we're doing right now. We've got someone from Pakistan, which is awesome. And Bethany is from, well, we've got someone from India again. It keeps moving on me. Bethany is from Virginia. I can't seem to get it there. Italy. Azib says, hi, doctor. So, and apparently I pronounced your name properly, so that's great. Welcome, welcome, welcome. I'm so excited to have all of you with me. This is so exciting for me to have you here. And really more important, it's exciting for me to be able to teach you how I look at specific cases and situations with patients and how we can get answers and explain the unexplained when you've been given that diagnosis of unexplained infertility. So, excuse me, I'm going to get started in just a minute. Give everyone just one more minute to join in. But I loved reaching out to all of you, knowing where you are joining from and hearing all of your connections that you're here. So someone did just post a question. What I'm going to tell you is I have a list of questions that I've already been that I've asked all of you to submit in advance. And I've got that in a document that my assistant has prepared for me. So those are going to be the questions that I start with when I get to questions, which will be at the end of the presentation. If you have questions for me that you have not submitted, go ahead and post them in the comment section here, okay? Um, we've got, I want you to continue to post them here in the comment section. I'm going to do my best, if we have enough time at the end of the presentation, to answer all of these questions. I may not be able to, and if I don't, what I'm going to tell you is that at some point over the course of the next day or two, I'm going to come back on here and get to these questions. Okay? But I'm also going to give you all a chance at the end of the presentation to schedule a discovery call with me so that we can dive deeper into your situation and also hopefully give you more answers, more specific answers. I'm only going to be able to do so much by answering your comments in this section here, because I'm going to have a lot of questions for you. So it's really going to be a lot of back and forth from me and you, and the best place to do that is going to be on our discovery call, which you can all apply for. And if you have registered and you're watching this on my page with this video, then the link is right below here. And if not, we're going to post a comment at the top of my comment section right here on YouTube that will give you that link as well, which is marksklar.com/discovery call. And so you can register for discovery call from there. But I do have limited space, but we're going to get to that. We're going to get to that. I just want you all to know that you're going to have time and I'm going to have time to answer your questions. I'm here for you. But the best place and the best way for me to dive deeper into your case and answer your questions is going to be through a discovery call with me and my team. So go ahead and register for that if that is something that you want us to do. All right, so I'm going to get started here. I've given everyone enough time. I do see all these wonderful, wonderful comments. Everyone keeps saying hello and from all over the world. So it's truly, truly amazing. And I do appreciate all of you being here. I'm going to start my conversation with this post from Bethany, okay? And Bethany says, Doctor, I'm 46, trying to conceive. Is there any hope? My goal with today's presentation is to restore the hope that others have taken away from you, is to bring back the hope that you can conceive if you have the right answers to create the right plan that will lead you to the results that you're looking for. And so I want to start to talk to you about what that right plan is or can be, right? And how we can start to get answers to the unexplained situation that many of us are faced with. So for all of you from all over the world and who are joining now, please continue to post your questions. I will do my best to get to them, but we're going to switch over to my presentation right now. So I'm going to share my screen. Give me one moment to go ahead and do that. And when I do, I should just mention to all of you, when I share my screen, as you can see right now, I'm going to switch over to my presentation. And as much as you can see me, I'm going to tell you that I can't see you and I won't be able to see the comments. You can keep posting. I can go through them afterwards, but I won't be able to see the comments. So just bear with me as I go through the presentation to give you the necessary information, and then we'll come back to that, okay? So we're going to do this. Awesome. And I'm going to start the presentation. Yes, present. And here we are. So explaining the unexplained, that's what we're doing today. And that is me. You get my picture in two places. So what is unexplained infertility? Unexplained infertility is a diagnosis that's approximately in 5 to 10% of couples trying to conceive, and all of the above tests are normal, and there's no apparent cause for infertility. So let's stop here for a moment, okay? In a much higher percentage of couples, only minor abnormalities are found that are not severe enough to result in infertility, and they are also not severe enough to actually be quantified and be part of the diagnosis, okay? The other piece that I want to make sure that you understand here is all of the tests that were done were normal. That's a key piece to what we're talking about today, okay? Couples with unexplained infertility may have troubles with egg quality, tubal function, or sperm function that are difficult to diagnose and or treat. May have, right? We want to be clear about that. And fertility drugs and IUI have been used in couples with unexplained infertility with some success. So sometimes what ends up happening is that patients will go in, they have unexplained infertility, or, which I'll get into a little bit in a moment, the doctor doesn't want to dig deeper to find answers. And so they say, let's just do IVF or IUI. And some of those patients do get pregnant, but they never get answers, okay? And if there's no pregnancy, after 3 to 6 treatments, then IVF might be recommended. The goal is to avoid that. At least that's my goal, I should say. So one of the things I want to share with all of you, make sure my volume is up, is I want to share a story from a patient that I worked with who did have unexplained infertility, and we found the cause, okay? And as you can read, she went through 8 doctors before she got to me. So this is a short clip, 1 minute, let's just listen.
Me and my husband, we started trying for a baby in 2012, and after trying for air, I did not conceive. I was the case of unexplained infertility. Unexplained because doctors were not able to tell anything why it's not happening. Like my husband's sperm count was okay, everything was okay from his end as well. Before approaching you, Marc, I saw almost 8 to 9 doctors. And I got pregnant. I got my first positive pregnancy test. I cannot express my gratitude, Marc. Like seriously, you are a godsend blessing. It's worth every penny. Your treatment is worth every penny. I mean it. Well, once you hold the baby in your arms, you will forget everything.
It's sweet. So I just want you to hear that, right? So that you understand that unexplained is not an okay diagnosis, and we need to get answers. And so on this training, you're going to learn, are you really unexplained? Is there really no cause for it? And how to be a fertility detective, and then the 6 steps to rule out unexplained infertility. Does that sound good to everybody? I know I'm not looking at the comment feed, but I'm assuming it sounds good to all of you. So we're going to keep going with this. Okay, this training is for you. If you've spent hours researching on Dr. Google, you've been discussing this with your friends and family, looking at books, you're just trying to get answers, and you know a little bit about supplements, you've been starting to take some, you've had some blood work done, but maybe just the basics, but nothing seems to work. It's also for you if you've been trying for longer than you'd like. Now, I'm not here to determine what that is. I think some of you maybe have been trying for a shorter period of time, and I might think that you can try for a little bit longer, but you are not okay with how long you've been trying, and you want to start looking for answers. And then if you don't know what to do and you feel overwhelmed, you know there's something missing, you feel like you're too old to waste your time, but you don't know what to do and where to go, that's what this training is about, and you're in the right place. Okay, this training is not for you, and I don't want to waste your time if you are looking for a magic pill to get pregnant immediately. Okay, it does not exist. And if you don't want to get pregnant, which I would imagine is not any of you watching, but I always like to just put that out there. And if you don't believe you can be a mom, because I believe in all of you. I believe that all of you can be a mom if we can find the right answers, create the right plan, and follow the plan. I believe in all of you. So I want you to believe in yourself as well. And if you're not willing to do what it takes to give your body what it needs in order to have a healthy baby, and that's what I mean by following the plan, is that there's going to be work for you to do. It's not just about the magic pill, as I stated before. And so we need to make sure that you're willing to put in the work and the time to yield the results that you want. And you get mad when I'm giving you 60 minutes of my best time and telling you how to get a personal fertility plan, then for sure this is not for you. And so I've allotted that hour today to be with all of you, and hopefully we can actually do this in an hour. So for those of you who don't know who I am Dr. Marc Sklar, the fertility expert. I've been helping couples from all over the world for more than 17 years with my online programs, my consultations. I do have 2 clinics in San Diego that I see patients locally. But even if you're not in San Diego, you never have to step foot in San Diego, because I will work with you from anywhere in the world, me and my team. So I do have a huge following on YouTube, which is pretty much where all of you are watching or have watched before, with over 100,000 subscribers, or just about 100,000 subscribers. I think I'm just shy of that for my fertility TV channel. I do Hope Coaching, where I help women from all over the world get pregnant with my fertility plans, and that was the testimonial you heard just recently. And then we see patients in our clinics here in San Diego. And these are just some testimonials that I wanted to share with all of you. But I also want to get to the meat of what we're trying to share. So I'm going to skip through this and let you know a little bit more about me and how I got started. So you can see this is my family here on the right side of the screen. And I helped my brother, this one right over here, and his wife get pregnant. And they were actually the first people I ever helped get pregnant naturally. And he was my first patient that I worked with remotely, virtually, because I was living in a different city and I supported them. And now they have 2 sets of twins. And then my first patient, which I've got to put up a picture in here of at some point, her name is Faith. And I helped her I helped her mom, I should say, about 18 years ago, 19 years ago. And she was the first little one, the first family that I helped to have a little girl. And she had PCOS, and I helped her with another child after that. And so that's what really pushed me in this direction, and really changed my life. So as much as I changed her life, she didn't realize how much she was impacting my life, because she changed the trajectory and the specialty that I was going to go into, which is why I'm doing the work that I'm doing today. And after that, I opened up my first clinic. We're having some great success. And then all of you from all over the world started contacting me because you wanted help from me to help you remotely. And that's why I started doing this sort of work for all of you. My team and I are able to help women from all over the world, regardless of the type of couple you are and the type of help you need and the type of treatment you're looking for. I can help you, we can help you, and we work with you wherever you are. So who are my favorite types of couples or moms to work with? Well, it sounds funny, but I like to work with the patients that are more complex, because I want to be your detective to get answers for you, right? No one is working for you. No one is on your side. I am on your side. And so my favorite couples are those who are over 30 and who have been considered advanced maternal age. Those certainly over 40 and are having issues with their egg quality. And then the 2 other categories is unexplained, which is what we're talking about today, and the more complex, more difficult conditions to treat, because that's where patients really need the support and the help. And so I want to be here for you. I want to be in your corner and fight for you and support you. So this is another testimony of Unexplained. So I'm going to share this. Again, it's just about a minute. So I'm going to share her story with you.
It was about 6 years ago. My husband and I decided it was time to try and have a baby. We thought it was going to be easy. We didn't really anticipate having issues. Started trying. It was about 18 months in. I got pregnant the first time and had a miscarriage. A little over a year later, I started having IUIs done at a local clinic. The first one was unsuccessful. The second one lost that baby. And so I did some research, and I eventually said, okay, I need a consult with this guy. Working with you was the start of, it was a massive turning point on a lot of different levels. And it was the first step that I needed to take, I think, in really changing how things were going. And figuring out what needed to be done and what needed to be addressed. And it really was.
So the really amazing thing here that I want to point out is she had multiple miscarriages, and some people believe that the diagnosis of recurrent pregnancy loss or miscarriage is a diagnosis in and of itself, but it's not. It's the symptom. We still need to figure out why that's happening, and we can start to do that for all of you if you want to apply for a discovery call. So you need to apply to qualify, and I'll tell you more about it in a little bit. But I'm going to start with the training now. And just so you know, okay, if you want to apply now, you can by clicking the link below or by going to marksklar.com/discovery call. But let's start to really dig deeper when it comes to unexplained infertility. I think many of you, if you're here now, you know that I don't believe in this diagnosis at all. I don't believe that there is such thing as unexplained infertility, that we don't know why. So let us all just press that reset button and stop thinking about ourselves as a case of unexplained infertility. And at least for these next 40 minutes or so that we're going to be together, let's start to think about this in a different way. So 1, are you really unexplained? What have you done to enhance your fertility? And more importantly, what have you done to figure out the cause of your fertility issues? What have you done to help your body be more fertile? Because if what you're trying to do every month is go through IVF or IUI or just track your BBT, that's not digging deeper. That's not figuring things out. Okay. And so we want to dig deeper. We want to get better understanding for these things. And I want you to reset your framework, your mind about what your fertility journey is about. If you're doing all the same things that you've been doing, we're not going to get answers. So we need to think about this in a different way. And that's what this is about right now. So have you ruled these things out? I'm going to actually stay on this slide for a little bit here. These are all the other possible causes, and there are still things on here that are not. There are still things that are not listed on here that can be causes as well. Okay, one of the more common things that I find in patients who are going through fertility and have been diagnosed unexplained is that they have thyroid issues. Most physicians do not look deeper into your thyroid. They do a superficial check. If everything looks okay there, then they don't dig deeper. And it's not because they don't care often. It's because they don't have treatment for it. So why look deeper? So thyroid is a huge cause. The other piece here, once you start going to your OBGYN and your fertility doctor, is hormonal balance or imbalance. Most of these physicians, as great as they are, do not, okay, to be clear, do not look at how they can support and regulate your hormones. They're looking to see how they can push a pregnancy, force a pregnancy. So if you're having an imbalance with your hormones, they're not really interested in trying to fix it or to even figure it out. And so there's tons of advanced and deeper tests when we start looking at hormones to determine if that's a cause for your fertility problems. We need to look deeper into your hormones. Okay? What is going on with your cervical mucus? Is your cervical mucus healthy? Do you have a good vaginal environment, which starts with your cervical mucus to create a healthy environment for the sperm to get where they need to go, right? And give them a chance, a fighting chance to get to the egg. Do you have that? Most physicians aren't even looking at that. Do you have poor adrenal function? Are your adrenals impacted? Do you have high amounts of stress? This is a huge one for many of you, because certainly if you didn't have stress before you started this process of fertility, you do now, because it's stressful and it's difficult. So what issues do you have, right? And how do we figure that out? How do we address adrenal health? Adrenal health is really challenging and takes time to fix and needs support in multiple areas because your body is impacted by stress in multiple ways. So it's not just about emotional stress. We've got to look at physical stress, the stress of not having regular sleep. These are all things that impact adrenal function. Let alone sleep alone is a thing that impacts fertility health and your ability to conceive. So where are your adrenals at? Body weight, too low or too high, right? What's your BMI at? If you're under 22 or if you're over 25, these are things that impact your ability to conceive and can dramatically reduce your chances. Diabetes is a big one. Autoimmune disease, huge. This is the kind of silent issue that I see with fertility patients who have been given the diagnosis of unexplained, especially many of you who have recurrent pregnancy loss. Obviously, cancer, that's not one I see very often, but it can be part of this. Premature ovarian failure, you're just not being diagnosed with it, right? And then potentially we can even dig deeper from there. Why are you having premature ovarian failure? So that might not be the final cause of things. Obviously, sperm quality and health is a big one that is often ignored. I get on my soapbox all the time that men need to be tested. I did that this week, and I got a lot of support from all of you about encouraging your partners or husbands to get tested because that's often ignored. So much so that I had a patient who said, who reached out to me this week and said, look, my husband doesn't want to be tested because he has 2 children from a previous marriage, and that was 20 years ago, right? But now he's in his 40s. So much can change during that time. Just because you have good sperm before doesn't mean you still have it now. Get tested. It's simple and straightforward. Injury or trauma to any of the reproductive organs. I've just started working with a patient who's a paraplegic. She had an unfortunate accident and she was left paralyzed. And so this trauma has impacted her ovarian reserve, her adrenal health, and so many other things that we are accounting for now. Injury or trauma to one of the endocrine glands, certainly smoking, alcoholism, drugs, addiction. These are huge ones. I've got plenty of stories around these specific situations as well. Hypertension, long-term use of medication, heavy exposure to radiation that we are not even aware of, and toxicity and environmental pollution. This is like a silent cause of fertility issues and something that we dig deeper with when we can't find answers, right? But we start at the more common things and then we go deeper and the list keeps going, right? You know, one thing I didn't put on this list is really interesting. I didn't put on this list PCOS. And this week I spoke to, I think I did a story on Instagram about it. I spoke to a friend of mine who is going through fertility struggles, and I haven't spoken to her in quite some time, some years. And she reached out because she was going through some fertility struggles and she wanted some guidance or a little bit more support and help. And I think she's got PCOS, and I think it was missed, right? Because she doesn't fall into the classic PCOS presentation, so they missed it. These are things that are often overlooked. And your fertility doctor, your IVF clinic, it's called an IVF clinic for a reason, is really focused on moving forward with IVF and not digging deeper to find the cause. So what can we do to dig deeper? And that's what this is all about, okay? So reproductive function is not a vital function for the body. That might sound strange to all of you, but it's absolutely not. There are so many more important things that need to happen before we reproduce, and that is much lower on the priority list. So it's the first thing that stops when something else is not working. If you are overly stressed, your body's in this fight or flight response. It's not worried about reproduction. It's worried about taking care of your body and healing itself. So reproductive function, having children, is going to get pushed down on the priority list. And we need to find out what that is and how to fix it and restore your fertility and reproductive function again. So, 2, we have to be a fertility detective because there's always a cause, I believe, and I am a fertility detective. I love using this phrase because it tells you exactly what me and my team do. We want to dig deeper to find answers, right? This is what excites me. This is what lights up my fire, because I love figuring out why you're having these issues. So I want to encourage you all, we can't take no for an answer. You can't let the person on the other side of the room with the white coat tell you you can't be a mom, there's no cause, there's no hope. You can't let them take that away from you. It's not okay for them to do that, and I don't want you to let them do that. We need to keep that hope, keep that belief, keep that faith in yourself, your body, that it can do what it needs to do, but we need to support it to do that. We can't just pretend that it's going to do it on its own if we don't change things, okay? And your job is to help your body be more fertile. Stressing and freaking out is not going to help. So it's important that you know how you can do that, and I'm going to let Jennifer share her brief story with you as well.
My husband and I got married. We decided after our honeymoon we wanted to start trying. We had about 6 months of just unsuccessful pregnancy tests, and it was just kind of getting scary because of our age. And you hear out there, if you're over 35, there's all these misconceptions. That's when Marc and we started to work with you, and you just helped support me and just say, hey, you're going to get pregnant. Like, you can do this. You're going to be fine. Stop listening to the negatives. I remember you telling me about there's natural ways to go. So I went to this natural IVF clinic. We got 3 eggs. 2 of them ended up being good. 1 of them didn't make it through the frozen embryo process or the freezing. And went in a month later, and they transferred 2 of the eggs, and now we're 5.5 months pregnant with twins.
So what she didn't tell you in that, okay, is that she, well, again, let me click here. Let's see here. There we go. What she didn't tell you in that video is that they missed a couple of diagnoses. One is stress. Stress was a big issue for Jennifer that needed to be handled, and they blatantly missed and ignored her thyroid. And so once we got that handled, she was able to conceive. Like, yes, she did go through natural IVF, but that was more a decision she made based on time, not on need. And if she was able to give herself the time, I do believe she would have gotten pregnant naturally if she wanted to. But it's not the point, because if she didn't already fix those 2 other things, even with the IVF, it wouldn't have been successful. So she put her body in the right place to be successful, because she allowed herself the ability to get answers and treat it. So keep in mind 2 things. Understanding your body as a whole. Your body is a perfect machine, and infertility is a symptom, not an illness. It's the cause of a problem, and we want to figure out why. And that's what I just went through before, is like all these other causes. And then we're not going to get pregnant if we stop believing in ourselves, okay? We want to continue to believe that we can get pregnant, that no matter how hard it is and how hard it's been, and no matter what you have to go through, that you can do it, but we've got to figure out why that's happening. So if you're just joining now, a couple of things. One is, I can't see the comment feed, but keep posting your questions. We'll get to them at some point. I will check that out in just a second, because I'm looking at my presentation, and I'm not looking at my other screen, so don't worry about that, but keep posting that. I'm sharing all my information here, so if you're joining in the middle, you can go back afterwards and watch from the beginning. Okay. And what I'm offering and sharing with all of you is an ability for you guys to dig deeper, to figure out why you're not getting pregnant, and allow me and my team to be the detective to support you. And we're doing that through discovery calls. You can sign up to apply to be approved and accepted for a discovery call. The link is below. And if you are watching someplace else where you can't see the link, or you're just listening, then just go to marksklar.com/discovery call. Okay. I am going to be happy to help you figure out why you are a case of unexplained, and let's explain it. Okay. So step 3 is my 6 steps. We're going to go from step 3 to step 1 again so that we can find some more answers here. But before I do that, I want you to listen to Brianne's story. Again, just 1 minute, okay? Because I know all of you can connect and relate to her.
My husband and I had started trying to conceive right after my 35th birthday. We got pregnant very quickly and then had a miscarriage. We lost the baby around 8 weeks. We tried to get pregnant on our own for about another 6 months, specifically because of our ages. We wanted to make sure that we had everything going for us. I went to Shady Grove. They called me and told me that I would never have biological children. Because I can remember my world falling down around me when they told me I'd never have biological children. When you told me, that's not true, that was huge for me, for us. We did a frozen embryo transfer. Here we are.
And you're almost how many?
Biological baby.
So everybody's path is different, and everybody's cause for fertility issues is different. Some of you will end up going through IVF just like she did, and some of you will be able to conceive naturally. There's no right path, but you're not going to be successful on any of those paths without the right answers and the right plan to start to make changes in those places, right? She wouldn't have been successful with her IVF like her previous treatments before she started working with me if she hadn't already put in the time and energy to get the changes that we achieved prior to her going through with her next IVF cycle, okay? So number 1, and I do talk about this often, so I'm sorry for beating a dead horse here, is get tested. Have you had all your hormones tested? Listen, I'm going to tell you, I speak to women every week who before our call tell me we have had everything tested and everything comes back normal. But when I look at their list is really short. I also look at, I also speak to patients who have, who jump on a call with me and have told me that I've been trying for X amount of time, 3 years, 5 years, whatever it is, and they haven't had any testing or very little testing done. Everything starts with testing and not guessing, okay? We want to have a reason for doing things. And just grabbing every supplement on the internet that says it's good for fertility is not a plan. It's chaos, okay? Having a plan is saying that, well, because you're diagnosed with these things, we're going to put you on these things. I had a patient this week. She went to see a fertility doctor, an IVF doctor, excuse me. He gave her a list of supplements to take, okay? Even, and he just said, oh, just based on your age, this is what you take. It's the same list he gives to everybody. And none of those things treated her cause. I know what her cause is. Her cause is that she's having implantation issues because she has adenomyosis, and he diagnosed it, but he's not treating it. He's treating egg quality. It's not the same thing. Why take all these supplements that don't work for you and that you're going to get frustrated with just because they say it's good for fertility? It might not be good for you and your cause, okay? So let's get tested. Let's dig deeper to find real answers to your hormones and everything else. You just saw that list before of all these potential causes, and I'm going to have some of them here, right? On step number 2 is check out every system, which is exactly the point I was going to get into, is that some of our fertility struggles have nothing to do with reproductive function or fertility. They have to do with all these other systems, right? When I posted that other list, many of those things were with other systems, like your thyroid. Look, inflammation here, right? The first one listed here is inflammation. Is that a fertility issue that's going to be diagnosed with your hormones? No. Digestion. Is digestion part of your reproductive system? It's not, but it affects it. It affects your hormonal biome, your estrobiome, okay? The microbiome of your reproductive functions, of your reproductive system, excuse me. So we need to make sure that your digestive system is functioning properly. This is something that I see often in many of my patients. Iron levels, are you anemic? What are your micronutrients looking like? Immune function, what is your immune system doing? That's a huge one. Blood circulation, blood sugar, adrenal function, and stress, like I mentioned before. This is the tip of the iceberg of things that we need to look at, okay? And I hope that what you're all starting to recognize is that there are causes. Am I answering all of your questions and figuring out, each one of you watching right now, am I sitting here and saying, well, you've got this is what it is. You've got this is what it is. I'm not doing that. But what I'm hoping that you are getting is that you are recognizing that there are causes to explain the unexplained when it comes to fertility. And that we need to figure out why, for all of you, these things are happening. So I hope that's giving you hope that we can find answers. Another thing that I often see is diet. So many of you come in saying, and this is why I talk about it so often, saying that, no, I don't eat well. Well, if you know your diet can need improvement, you don't need me to tell you that, right? You can start to make changes. Now, I might, once I have a diagnosis for you, I might create a custom, I will create a custom diet plan for you that is more specific to your needs and your diagnosis. But all of you know that you could do better with your diet, so you don't need me to tell you that. Start doing those things now. And there is no one size fits all when it comes to diet. Not all of you should be on keto or Whole30 or paleo or Mediterranean or whatever diagnosis or whatever diet you want to come up with. There's no one size fits all when it comes to diet. It's what's appropriate for you. And these might be just outlines and templates that then need to get massaged or tweaked for your specific case, okay? So diet is huge and impacts your body tremendously. There was a study done that showed how impactful eating organic and clean was, that within, I think, just 2 or 3 weeks of making those changes, cleaning up your diet, cutting out the sugar, eating organic, they were able to see changes cellularly in patients. You can do that too, okay? So if you haven't started, start doing it now and just do better. Number 3, removing toxins. This one gets a little bit deeper and trickier. Most of us are surrounded by environmental toxins and other toxins because of our personal hygiene products, okay, and the world we live in. So we need to get rid of those things as best as we can. Drinking from glass instead of plastics is a huge one, okay? Another one is we're all, I think many of us like that new smell, and I always equate it to like a new car smell. I just heard a colleague talk about it before, like, oh, it was so nice. I got in this car, it was brand new, it smelled brand new, right? There's this feeling, there's this smell and odor that we associate with it. You know what that smell is? It's called off-gassing. It's called toxins. So, you know, you're putting yourself in a car, closing the doors to breathe in and inhale toxins when you put yourself in that situation, right? Buy used. There are things that we can do to change our exposure to that. I just, and I've been wanting to do it for quite some time, I just put in a whole house filter in my house to filter all the water that comes in, because of all the toxins that are in the water in the city that I live in. And I can smell the difference. I smell the difference immediately, and I can feel the difference, right? So we're all exposed to these things. What can you do to clean things up? It doesn't have to be as dramatic as what I'm saying, and you get to those things when you can, but you have to start in one place. So my suggestion for all of you, first and foremost, is you start with one thing. As you have to buy a new thing or change something out, you just swap that out for something better, right? There are other ways that we're exposed to toxins. The computer, our cell phones. What can you do to improve your exposure and minimize your exposure? So toxins is big. And this is often one that we have to get to later on in the process. Review your lifestyle habits, right? What are you doing that's right or wrong? Only one alcoholic drink a week or none? And in what form? We were just talking about toxins in the US. all wine and beer that is, aside from the alcoholic part of it, right? But all wine and all beer that is produced in the United States has Roundup in it. All of it, organic or not. So maybe you make different choices about the type of alcohol you drink or where you get it from, right? And that's just the tip of the iceberg. Quit caffeine if it's a problem. I don't think it's a problem for everybody. You see that I've got my coffee right here. I love my cup of coffee a day. But for some patients, it is a problem, right? If you've had multiple miscarriages, caffeine can be a cause of that. So does it make sense to remove it right now? My answer would probably be yes, or change the form that it's coming in. Do you all exercise regularly? For women, I like to see 3 to 4 hours of exercise a week is what the research shows. Men could do more than that, but it needs to be moderate. It can't be crazy. Are you stressed out? What can you do about that? What time do you go to bed? Are you getting enough sleep? It's probably the most overlooked thing that we do as a culture is minimize our sleep for the sake of other things. I just want to binge watch on TV and watch one more thing, or we're just trying to accomplish more at work, and so the place that gets sacrificed is our sleep. So what are your sleeping habits, right? What are you doing for yourself, your lifestyle, to bring joy and happiness into your day and your week? These are things that are hugely impactful, and I can't tell you how often I just make those tweaks with patients and they're able to conceive. So what can you do? And follow a fertility plan, right? Not just going by everything that you read on the internet and just grabbing anything that says it's good for fertility, like I mentioned before, right? We all need a plan to follow to make it easier and more streamlined for you, right? And in the long run, to actually save you money so that you're not just doing all sorts of things, right? Do you need help creating a clear plan so that you can feel empowered? Do you know what can be done to empower the areas we just covered? And asking for guidance is one of the most important things you can do, because it shows that you're willing to change and get a different result. Okay, and that's exactly what Danielle did here. So again, just one more minute and you get to hear her.
We went to a specialist in the area, and he basically just said to me, lose 100 pounds, and that's the end of it. We'll talk then. I came across your YouTube videos. Yeah, that's how I found you. That's actually how I ended up finding out who you were, and I just felt that you were just a wealth of knowledge at that point. And I said, well, if this guy, is willing to put out information online about how to get pregnant, or just information about teaching women about their bodies, let me talk to you. At that point, I was probably about 1.5 years into trying to get pregnant, and no luck, and then I sought you out. I gave myself 2 months. We tried again. We did IUI, and it took on the third try, and we got pregnant. And we had a beautiful baby girl a month ago.
Okay. Are you feeling overwhelmed with everything that I just said? Because there's so much to look at. Being your own fertility detective is possible, and you have many tools to get started here with what I just said, right? I've given you some outlines of places to look at, things to change, what to do. But what might happen is that focusing on all of this, you forget about the most important thing, which is enjoying life, and that it potentially brings you more stress. So there are 2 ways that you can go about being a detective and getting more answers to explain your unexplained fertility issues. We can do it the more difficult way, which many of you have been doing, which is searching through Dr. Google, starting to try to figure things out on your own, maybe being able to get more testing on your own, but often that's difficult. And what I often say is, like, as a patient, I don't like to treat myself. So when I need help, I look out to others, because it's difficult for me to see the forest through the trees, because I get bogged down on my own things, right? So you can, but then you're playing fertility detective on your own, and you've got to figure that out, and it becomes a little bit more challenging. I'm not saying that it's not possible, it's just a bit harder, okay? Or the easy way is work with my team and I and apply for a discovery call to see if we're a right fit so that we can support you to help you create a fertility plan, have a personal fertility plan created for you, follow what has helped so many other women and couples, getting on the right supplements, the ones you actually need and not the ones that everyone tells you you need, and having the right testing and enough testing to avoid wasting money and time. And then also hopefully getting the guidance on the lifestyle you need to have for a healthy pregnancy so you get the right support. And having a fertility coach is just like working with any coach, personal trainer, tutor, life coach, psychologist, physician, whatever it is, right? We all need coaches in our lives. I've always need coaches to help support me. And I think those who are the most successful are the ones who have jumped in to work with coaches. So that's the same thing for all of you to help you get answers to guide you through the process. You've seen some of the many couples that we've helped get pregnant, many misdiagnosed as unexplained, women from all over the world, wherever you are, you name it, I've worked with you or spoken to you. Those doing IVF, trying naturally, same sex, traditional couples, single moms, they don't take no for an answer. And they don't let it stop their dreams. Okay. And we don't want that to stop your dreams, which is why I'm here with you today, is to really support all of you through that process and give you an opportunity. I want you to be the next mom, woman, couple who takes control of their health to make the necessary changes. Right. And by doing that, you can do that by working with my team, right? Dedicating our time to helping you get more answers. My team, my staff, me, we're 1,000% invested in you, and we want to put you, your baby, on our baby wall, right? I want to get an email from all of you with a positive pregnancy test and then a picture of your baby, and I want to help you do it, okay? So here's how the process works, okay? Regardless of the type of woman that you are, if you're ready to make changes and become healthier, you've tried naturally or with IUI, regardless, you're just committed to being a mom no matter what it takes, and you want a clear plan to follow, okay, then, and you're ready to take a different action, a different plan, okay, that's what we're offering you today. Again, going back to all those people, if you're looking for the quick fix, if you don't want to put in the effort, this is not for you, okay? We want all of you, and I know it's all of you that are serious, you want to make changes, you want more help, you want more guidance. Those, I want all of you, okay? And I know you're ready to be a mom. So what I've done with my team is I've allotted specific time over the course of the next 5 to 7 days, over the course of the next week, to sit down and talk to all of you on a discovery call, okay? So I want you to apply to be part of that discovery call. I've only got 10 spots over this time frame to sit down and talk to you. And I'd love to talk to all of you, but I can't. So you've got to fill out an application so we can get you the schedule to fill out, to apply, and to schedule with me and my team, okay? And I want all of you who are 10,000% committed to your health, your fertility, and getting answers with me. That's why I've opened up these spots, right? So if you're still watching, which is awesome, and I hope it's most of you, that means you're dedicated to yourself, your family, and your future baby, and you're ready to take action and move forward with hopefully getting a personalized fertility plan for me and my team, okay? And that's what this is all about. So you've got to qualify, and to do that, you've got to apply. So if you're watching on my watch page, the link below to apply is right there. If you're watching some places or listening and not looking at your screen, then all you have to do is go to marcssklar.com/discovery call to apply, so that we can make sure you're the right fit for us, and so that we can sit down and have a conversation to start helping you. Okay, again, I've only got 10 spots. And I want to change and flip the script from unexplained to explained. I want to help you figure out why, and I want to do that this week. So if you're ready to do it, I want you to do it. I want you to apply, okay? I don't want you to wait. I don't want you to think about it. If you know in your heart that you need answers and you want us to support you on it, I've got 10 spots. And this week is the week to do it. So sit down and apply for a discovery call with me by going to marksklar.com/discovery call. Okay. So there's nothing to watch. This is such a beautiful story. It is a long story. So I'm just going to play some of it. And then while this is playing, I'm going to switch back and look at my chat feed to see what questions we have. And then I'm going to start answering some of the questions you already submitted, okay? So give me just 1 minute. I'm going to press play here. And I want you all,
so I'm happy to be able to share my story and
I want you to listen to the story.
We faced battling infertility. I was actually 33 when I met my husband, and we were 35 and 38 when we thought about, becoming a family and welcoming a little one to this world. Little did we know it would be such a challenging and bumpy road. I actually fell pregnant quite a few weeks after we decided we wanted to try conceiving. Regrettably, I had a miscarriage. And not only one, but 2 and 3. And of course, this is when my gynecologist here in Switzerland started to wonder if it was perhaps time to do some more testing. I also had to have an intervention, and this is when we found out that I had endometriosis and what they call, I'm not sure I'm pronouncing it properly, antiphospholipid syndrome, which is the presence of antibodies in your blood that can cause recurrent miscarriages. And of course, we were devastated, and this is when my gynecologist at the time thought maybe it was time to give IVF a go. We did one cycle, which turned out to be a failure. The second one was a bit better, but still, after the implantation was no baby. And after the third failed IVF, this is when one of the best clinics in Switzerland told us that, unfortunately, they were really sorry, but there was nothing more Western medicine could do for us. And that the other options we should be looking at were adoption or egg donation, which, of course, we had in the back of our mind thought about. But we were left with our questions. We wanted to know why us. I wanted to know what was wrong with me. Like everybody else, I was wondering if I was not meant to be a mom. And more than anything, I guess we were wondering if there was anything else we could have done. And here we were looking for some answers on the internet. And this is when we came across Marc's videos and Marc's channel, which were enlightening to say the least, because finally, we were able to get some clues. You know, we heard about detox, about alternative medicine, about nutrition, about genetic.
Okay, so I'm going to stop that. I'm not sure if it's coming out clear. I heard some people commenting that it sounds a little bit funny and so forth. What you can hear from her is that no one was willing to, and I'm going to hide this right now and come on full screen with all of you. What you can hear from her is that nobody was willing to look deeper. Nobody was willing to get her the right answers for what she was looking for, right? And then we started working together, okay? We started to dig deeper, just like I've been talking about on this presentation for all of you. So hopefully this presentation hits you. It makes sense. I've looked through a little bit of the comments as she was talking initially so that you could see that I could see that all of you are connecting to what I'm saying, that you know that there are answers out there and that there are more answers to be gotten for all of you, okay? And I want to support you in that process. So again, if you want to get more answers and if you want our help to get those answers, then just apply for a discovery call. The link is below here on this page for you to apply. It's also, you can just go to marksklar.com/discovery call to do that as well. And what I'm going to do is there's tons of questions here. I don't know that I'm going to have time to get to all of those, but I did ask for everyone who registered to be part of this training. I did ask for you to submit any questions you had, and I have a list of those here, and I'm going to start with those, okay? And then if I can't get to all these questions here, then what I will do because there's a lot of questions here, what I will do over the next 24 to 48 hours is I will come back onto here and answer your questions. But I want to tell you all, the best way for me to answer your questions and support you and really get to know you is for you to sign up for Discovery Call so that I can help answer your questions privately and we can really get a little bit deeper with things. So make sure you go ahead and do that. Tiara says, hello from New Jersey. Hello, thanks for joining. And you're welcome for me turning off the audio. So let's see this. Let me pull up these questions. Give me 1 second, okay? So when I do this, I'm not going to be able to look at the chat feed again because I'm going to be looking at these questions. So give me 1 sec here. Okay. First question is, how would you recommend combating negativity that sets in and creates false beliefs that do not serve us? Examples of false beliefs or cognitive distortions are, it won't happen to me, it didn't work in the past, so it won't work now. Being infertile means I can't have children ever. So I want to tell you that these are all just things that our mind tells us. These are not true and they don't have to be true, but it's difficult to break that cycle. So the best things that the best tools I can recommend for all of you is that you write some mantras or affirmations that you repeat to yourself. I even love to take my phone, record my affirmation and then play it back to myself so that I can hear myself do that. And you've repeating it to myself, and you're going to repeat it to yourself often throughout the day when you need a lift up, okay? I also want you to have a gratitude journal. What are you grateful for today? One thing you're grateful for today, and that will start to change the plan. But also I want to tell you one of the more important things is if you are around people that are negative, don't support you, and don't believe in you, you need to drop them and find people who are going to support you and be there for you and who are going to be positive. Question number 2. Okay, my question is Clomid still a valid way to measure FSH and AMH? I was told to go to an infertility doctor here in the US, and he gave me Clomid and came to the conclusion that the only way I would get pregnant would be via donor egg. My husband's sperm was all normal besides morphology, which was below 3.5, but infertility doctor said all was fine with the sperm. Then went to an endocrinologist in Athens, and he told me that Clomid is not a valid way to get answers. And if the results, if the results only, the AMH is a bit of a concern, but since my period is always on time and very normal, I should be able to get pregnant naturally. Clomid is not the best way to tell us if you are able to get pregnant. And the testing you've had done is just the tip of the iceberg in that. And I do think your husband needs to have a little bit more support in that process. Question number 3. Hi, Dr. Marc. Thanks for the uplifting emails and encouragement. I have been pregnant 3 times, yet have no child. My last pregnancy ended about 8 weeks. I then reached out for help and was diagnosed with unexplained infertility, which, again, you've heard me say it through this whole presentation, doesn't make sense, especially with those of you who have had recurrent pregnancy loss. I got pregnant again about a year later and am currently experiencing symptoms of a missed miscarriage. Oh, I'm so sorry to hear that. So my question is, in addition to actually getting pregnant when challenged, is there anything that can assist in keeping the pregnancy going? Fertility challenges are frustrating and they hurt, but fertility challenges and recurrent pregnancy and recurrent miscarriage are heartbreaking. Absolutely, they are absolutely heartbreaking, and it's very difficult. What I want you to take away from the whole piece of this is if you have miscarriages, which suck, okay, they absolutely suck, my heart breaks out for you. The first positive you need to take out is that you can get pregnant, so that's a huge step in the right direction. Now we need to dig deeper, and there's tons of ways to figure out why you're potentially losing the pregnancy, and this is exactly what I do for patients. But most doctors won't run these tests, and you've got to start really digging deeper to see what's going on with your immune system and blood clotting and toxins. So absolutely, there are things that can be tested for, and a plan can be made for that. Does a urine infection, fungal infection, and blocked tubes prevent from conceiving? Can they cause infertility? For sure, blocked tubes can make it more difficult. But I have a patient that I've been working with for over 1.5 years with blocked tubes, and she's now pregnant, and she's about 7 weeks pregnant. So it doesn't have to be it doesn't have to prevent you potentially, but it can take a little bit of time. More importantly here that I want to get to is the urine and the fungal. These can absolutely impact your reproductive health and function. These absolutely need to be cleaned up, and they take time to address. So these can be big causes for why you're not able to conceive. What are some of the potential reasons for low AMH, and can AMH ever be increased as we age? I do believe it can be increased, maybe not in everybody, but in many. And there are many reasons why you might have low AMH. It might be stress. It might be low vitamin D. It might be trauma to the area. I talked about like trauma to the pelvic region. That can cause it. You know, my patient that I mentioned before who's paraplegic, her ovarian reserve, she's young, but her ovarian reserve went down after the trauma because her body is trying to hold on and preserve. So that can absolutely be a cause, and that needs to be addressed. And then next question. We've got 2 more questions here, and then I'm not sure we're going to have time, but I'm going to see what I can do. Can surgical history to the abdominal and pelvic area be causing issues with natural fertility? If so, any recommendations, suggestions on working to minimize the trauma around those areas? Absolutely. We just talked about trauma, right? And trauma comes in all sorts of ways. So if you've had surgery in those areas, it can definitely impact your ability to conceive and hold a pregnancy. And my suggestion should really just depend on what we're seeing there. Okay, but we need a good uterine environment to definitely make changes there. And then do ADHD medications have an impact on male fertility? Yes, I have seen this be the case. And so, but that's hard because then you've got to treat a couple of things. So that is a challenging thing. But the short answer to that is yes, it does. So I've answered those questions that were submitted beforehand. I'm going to see if there's 1 or 2 questions here that I can look at. Let's see here. I'm going to put how can I put this one? Can I put this one up on the screen? I can't see it. Why can't I? Now I can. Here we go. There we go. Okay. Loyalty for Life says, I have PCOS and I'm 35. I don't know what type of PCOS it is. I've never been pregnant. What should I do? I'm getting married and neither one of us have kids and we want a family together. Here's the thing that you have working for you, okay? You know you have PCOS. Now you need to get answers to what type of PCOS that is so that you can create a proper plan. You're in an okay place. You just need to take action to make that happen, okay? And then Tiara says, can a UTI cause miscarriage? It potentially the infection can. It's not common. I would start to dig deeper as to why that's happening, why that infection is happening. Okay. And I've got one last question that I can answer. And then, unfortunately, I've got to go. But I will come back, like I said, to answer these questions later. But the best way for you to get answers to your questions is to sign up for a discovery call so my team and I can support you and help you reach the goals you want, which is a healthy, successful pregnancy and delivery. Okay, so click on the link below to sign up for a discovery call, or just go to marksklar.com/discovery call. Let's see here. Where is it? Sunny says, hello, sir. I'm 37, had implantation failure 4 times in the last year. What can be the reason? Reports are normal. Please suggest. I would suggest that all the reports haven't been done and that we do have to look deeper as to see why you're not implanting properly. And we might need to start with your immune system and potentially your thyroid. But that list that I gave you before of all these other potential causes for that could impact your fertility is definitely the list that we start with that can start to give us some answers. So hopefully you all learned so much on this conversation, on this training. I'm grateful, extremely grateful to have all of you with me today, to be here to learn and hopefully to grow and see changes that we all want to see. And I want you all to, if this is something you want, is to sign up for Discovery Call with my team and I, so we can help you get answers and create a plan. Loyalty for life. Last thing, she says, can you help find out what type I have? Absolutely, I can. It starts with testing and a conversation, and that starts with a discovery call. So use the link below or go to marksklar.com/discovery call. And you all have a wonderful, wonderful day. Much love to all of you. Stay fertile, and I will see you soon. Bye, everyone.